And now Dr. Hovanesian shares information about an innovative lens implant that's changing the lives of patients with macular degeneration.
Macular degeneration is a disease that causes damage and loss of vision through a process that affects the center of the retina. The macula is the center part of the retina, the back of the eye, the part that takes light images that come into the eye and turns them into a signal that the brain can understand. In this disease, the very center of that structure, what gives us our detail vision, is affected. Macular degeneration causes our view of the world to be profoundly affected. Imagine if you're looking at my eye that there's a black spot or a smudge right in the center over my eye, or it may become larger in some cases to affect the view of the whole face. Everything we look at is distorted. Everything we try to see and do is affected by this thing that's in the middle of our vision. In the past, treatments for macular degeneration have focused primarily on stopping the damage in the back of the eye. They've consisted of laser treatments, where we use laser light to stop leakage and bleeding in blood vessels, injections, which do the same thing. The problem is that all these treatments really focus on stopping the damage from continuing, and they really aren't designed to make the vision better. When macular degeneration reaches its end stage, where vision in the center is affected in both eyes, that's when someone becomes a candidate for an implantable telescope. The implantable telescope is designed to magnify a patient's view of the world so that the affected area in the retina becomes smaller. Another way to think about it is to think of the retina like a projection screen that we're looking at. And the disease, macular degeneration, is like a spot on that screen. What we're doing is magnifying the image on the screen so that we see it much larger, but the spot that's part of the screen itself doesn't change. And so we have an easier time seeing what we're looking at. For our patients, an implantable telescope means that many people can now read their checkbook and write checks. They can play cards with their friends. They can watch television. They can recognize faces. They can go grocery shopping on their own. In the past, all of these things may have been impossible, but now they're given back their independence. We have an extensive training program designed to help determine which of our patients are good candidates to have the implant before they're treated, and then afterwards to go through a training so they can learn to use the two eyes together to make the best image possible of the world so that they can improve their ability to do things independently.
As we've learned, technology has played and continues to play a huge role in the successful treatment of eye disorders and in the quality of lifestyle for patients.
Lens implants have been probably the biggest advance in surgery, in ophthalmology. They have made it so that people can see now quite clearly, and for the rest of their lives. It has been very, very successful. I'm thrilled with it. And I don't know anyone nowadays in the world who would go without a lens implant.
As we end the special edition of the American Health Journal, we wish to acknowledge and thank the eye care professionals at Harvard Eye Associates for their participation in making this program possible. If you have any questions regarding any of the topics you've seen here today, please call us at 1-800-303-3200 or check out our website, AmericanHealthJournal.com. Thanks for watching our program, and as always, we'll continue to bring you the best in healthcare for your better health. For the American Health Journal, I'm Roger Cooper.